It's Dr. Fawad Mian from Neuro Wellness MD and Proly Healing Med Spa. Today, I'm talking to you about making sure you pay attention to what's happening with your body and how to stay in tune with what's happening with your body. More often than not, we tend to neglect ourselves, myself, yourself, and everybody else. We don't pay attention to ourselves as much as we should, and we ignore the signs medical issues start creeping up. So before those things even start happening, pay attention to how you're feeling. See if you are feeling that you are more stressed than you do. And if you're more stressed, are you having more headaches? Are you having changes in your vision? Are you having any dizziness? Are you having any increased neck pain? Pay attention to these kinds of signs. Sometimes they can be simply from your stress, but they could also be a result of other things too. It could also be from chronic stress that's starting to cause medical issues too. Pay attention to your sleep. Sleep often gets neglected. Not getting enough rest makes everything worse. Everything hurts more. You can't remember anything. You don't feel like you're in a great mood. You don't want to do anything. And then you end up doing something that ends up being somewhat comforting for some people. That's scrolling on their phone, as it used to be watching TV and eating things that you probably shouldn't be eating routinely anyway. We definitely want to get out of that. And I think that's something that we always want to pay attention to. Sleep is very critically important. But the other thing with sleep is if you are still having chronic sleep issues, maybe then it's also time to think about maybe this should be evaluated. Maybe it should be tested. Because there are sleep disorders that actually can deprive your sleep and lead to long-term health problems such as stroke, heart attack, high blood pressure, diabetes, and so forth. Pay attention to the warning signs in your body. Pay attention to the aches and pains that you're having. What movements are you doing that actually can affect your pain levels? Is it being on the computer all day and typing all day? You're having chronic neck pain and headaches. Could you potentially change the way that your keyboard is laid out or your mouse is laid out? I often tell people a wireless keyboard, wireless mouse goes a long way in terms of alleviating some of the symptoms and being set up ergonomically. There are stretches that can always be done, which we always show in the office, and other little hacks that we can potentially use. Pay attention also to your fluid intake. So, for instance, if you are not urinating at a normal frequency or you're not urinating much at all, it can be a sign that there are other things internally happening. Even bowel movements. If you're going a long time without having bowel movements, most people in general should be having a bowel movement on a daily basis. And if things aren't really moving very well down there, then inevitably it leads to stomach issues. And as I see people with stomach issues, they can also have neurological issues. Pay attention to that. Maybe it's time to actually get that evaluated. So I hope you feel that this has been an insightful video. And if you feel that you need more help with any of this, and you feel that you need to be evaluated now because things aren't getting any better from the things that you're trying, then please come to our office. We'll be more than happy to help you.